Hi everyone, what's going on? I'm Dr. Christiana Maron and I am a doctor of physical therapy, and I am here today with Dr. Tom McCawley. Dr. Tom McCawley is a periodontist of over 40 years. He has saved thousands of people from suffering from very, very bad periodontal disease. And he's here today to help us educate other patients on decreasing the likelihood of a patient getting gum disease from their favorite pet, their dog, or vice versa. So I'm gonna let Tom introduce himself and I'm gonna let him take the stage.
Okay, thank you. So Dr. Maron and I have been talking about how well she takes care of her dog's teeth, and our purpose today is to help you save your dog's teeth and possibly your dog's life, because dogs get gum disease actually way more than humans. I treated human periodontal disease, and I've seen our patients get gum disease from their dog, actually. In fact, one of our hygienists, her husband, she couldn't get rid of the infection in his mouth because he kissed his dog all the time. She actually did the bacteria in his mouth and did bacteria in the dog's mouth. They were exactly the same. So our goal is to help you save your dog's teeth and possibly the dog's life. So that starts with the fact that this disease, this is from a veterinary office actually, and what it says is that the bacteria associated with periodontal disease may damage the kidneys, liver, and heart. Daily brushing and professional dental care at regular intervals help promote oral health, longevity, and we have a model here that shows what you can do with healthy teeth and what happens when you're not brushing your dog's teeth and all the disease that happens. And what happens is they get abscesses then, and those abscesses, the bacteria gets into the bloodstream and can affect their heart, and actually there have been reports of death from gum disease. And plus your dog's in pain and loses teeth, and it costs you a lot of money. And there's really a simple step to stop it. And Dr. Maron does that, and we'll show you her dog who's 5 years old and teeth are perfect. And the way she does it, she brushes the dog's teeth a couple of times a week. Is that correct?
Correct.
Yeah. So that's all you need to do. About twice a week will do it. It's not, because the bacteria take really about 36 hours to regrow, and if you brush them twice a week, that's going to work. Because think about it. Now, if you yourself only cleaned your mouth, well, you never brushed your teeth, never cleaned your mouth at all, and you went in once a year or even less than that and had your teeth cleaned under general anesthesia, how would you like that? And what do you think the results would be? You would end up with lots of gum disease. And the general anesthesia that you're under, as you may know, actually can cause some cognitive problems in humans and in dogs, and an occasional death. There are reports of death from general anesthesia for dogs. So it's much easier if you just start cleaning your dog's teeth. And the other thing is, whatever you do, don't kiss your dog, all right? So this I just took off the internet today. This is a lady. They were saying, we take really good care of your dogs. We're so gentle at our clinic, we even kiss your dog. Well, the disease is transmissible. So if you have gum disease, you can give it to your dog, but we see it because dogs have more gum disease than humans because nobody ever brushes their teeth. We see it from the dogs coming to humans. So that's one of the things we watch out for. So there are lots of things you can use, but there are lots of terrible things out there on the market. This has green tea, natural, that's garbage, all right? And they put 1 teaspoon in there in your dog's water. Oh, brother, that's a joke, all right?
And how much money do you think that is too?
Well, let's see, that was $13.
$13
for this is a waste of your money and time. So most of the other stuff out there are basically worthless, all right? But the things that we've found that what?
I'll show them.
Yeah.
So we'll show you a couple of things. Like if you were to go into the dental section in the pet store, you know, they're promoting a lot of this stuff, but a lot of what Dr. Tom has educated me on is that a lot of it's garbage. You know, a lot of it is you're paying for purified water, natural derived alcohol, glycerin, you know,
green tea leaf
extract, chlorophyll. That's not going to kill bacteria in the dog's mouth. And what was interesting to me was, you know, Dr. Tom educated me on the fact, you know, when he saw Chloe, my dog, and couldn't believe how great her teeth were at 5 years old, he said, you know, what have you done? And I said, well, my concern was that when I first adopted Chloe, she was a rescue, and I had seen that someone's dog had passed away from periodontal disease. And I thought, that's such a shame, you know. Someone can be, you know, a pet owner and their dog dies because of something that they neglected, you know. I think that's very sad, and I think that's terrible, you know, losing a very loved companion of yours to something that you could have prevented. So from the time she was a puppy till today, I've brushed her teeth multiple times a week. And for her being 5 years old, even the vet is always asking me, hey, do you want to get on a dental plan, or we'll put her under today to get her teeth cleaned? And I'm like, why don't you check her teeth first? Because their first thing is, well, at this age, that she's probably dealing with periodontal issues, you know, gum disease, and we should get her in. And then they're amazed at how clean her teeth are and how great her gums look because of all the care I've taken. And I'm guilty. I've bought some of this stuff off the market because I didn't know better. You know, I shopped and I looked at what I could find, and I did use it. But then I got to a point where I didn't really see a difference. So my mother, who's, you know, been a pet owner for years, she said, well, why don't you try doing diluted peroxide and clean her teeth that way? And that's what I've done for a while. So Tom's going to show you guys also.
So that's a pretty good option right there, because it's already diluted to 1.5. 3% actually is a little too strong that you buy over the market. This has a little flavor in it, but regular peroxide's fine. That's good, but even better would be a chlorohexidine one. So this you can buy over the internet, actually. I discovered this morning. It's called DentaHex, and it's got chlorohexidine and zinc in it, and actually will help. That's the best of all, because that has what we call residual action, so it stays on the tooth for like 12 hours, keeping plaque from growing back on it.
And it's chlorohexidine.
Chlorohexidine.
I'll put that in the video here.
That's the best thing. That's the best thing there is out there. The thing that I liked the best of all the ones that I saw was the one by Arm & Hammer here. All right, because that has actually baking soda in it. It has something that will reduce tartar called pyrophosphate. So it actually is not bad. But the truth of the matter is, you do not need toothpaste or anything. It's just a regular mechanical cleaning is with a toothbrush. And I like the one here, the small head, so you can brush with that small brush and get in there. But if you just brush, that's fine. I would brush, and then I would take the chlorohexidine mouthwash and paint it on the pet's teeth. And I think that would be the ideal program. You can, if you want to brush with peroxide, that's good, but you don't need paste or anything. That's just cosmetic more than anything.
Now they have a lot of these, do you want to grab that green one? They have a lot of these finger brushes here. I had tried this in the beginning when she was a puppy. You know, you put it on your finger and then you get it in the pet's mouth and do it that way. She is a little bit bigger of a dog and she's got bigger teeth, and I just found I didn't want my hands getting chomped on, so I do a soft brush toothbrush with her. Very simple, but it's a soft brush. It's not a hard brush. And I do try and scrape her tongue as well.
Those are human brushes right there.
These are human brushes. You know, she's a bigger dog. She's a bigger dog. But I found that to be the most successful when I brushed Chloe's teeth.
Right. This small-headed brush may work for a small dog, you know. So just get maybe even an in-tough brush that you can buy to brush your teeth. But the key thing is do it. Twice a week, that'll do it. All right? And then At age 5, the teeth will be perfect. At age 10, they'll be perfect. You won't be spending a ton of money, and the dog won't be in pain, and the dog will even get sick from it, and the dog may give you gum disease, all right?
Now, what other diseases can occur in a dog, just like a human, if they do suffer from periodontal disease?
Well, it gets into the heart, all right? It gets into the lungs. It gets into all the organs, really. So it's a risk factor for probably 30 different diseases. It can even increase the risk of oral cancer. So, you know, it's so easy. If you just start brushing the dog's teeth, you can prevent a lot of disease, maintain the dog's health, and save a lot of money. So, and a lot of pain for the dog. And listen, your dog is like your kid. You know, they go in there and they're having to have their teeth pulled or something. You don't want that. So just brush their teeth. Now, it seems to me, although I haven't really done this, that starting it early like Dr. Maron did would be the best. But you can start late if you just be very gentle and make it a positive experience. That's my thinking.
Now, you had told me at one point too that even so, doing it on dogs is great because they have a lot of space between their teeth.
It's
right?
so easy, yeah. In fact, way better, you know, because we've worked and worked and worked. I know Dr. Maron has too, but we've tried Chloe, and Chloe's one of the best dogs you'll ever see. She absolutely will not floss. We just can't get her to do it.
She won't.
No, she won't do it.
She won't do it.
But fortunately, she doesn't need to because there's plenty of space between the teeth.
Right.
But, and you've trained that dog to do everything, but not flossing.
She won't do it.
She just won't do it. Okay. That's the...
Do you want me to bring her up here and give
Yeah,
you
let's bring her up here. Give a little demonstration how she does it, because this is an example of what works. And we have mostly examples of what's not working. So we actually warn our patients, okay, don't kiss your dog. Most of them have gum disease already, and we don't want it to come back by getting reinfected. And actually, we don't want them giving it to their pet if the pet doesn't have it, but most of their pets will have it.
So this is Chloe, and I'm going to show you guys what we do with her. Now, she likes to sit too, and I want to show you guys. You can see.
Look at those teeth.
Her gums are very clean. Those teeth are very clean.
They look just like this model here.
What you don't want to see is this, and that can mean that they're also in pain and discomfort as well.
Also, if you see bleeding, bleeding is always a sign of disease in your mouth and in the dog's mouth. So if you have bleeding gums, it always indicates disease. Even though it's very common, a lot of people think that's normal. It's normal because a lot of people have gum disease and a lot of dogs have gum disease.
Right. So if I were to do it, I dip this in a little bit of the peroxide, the diluted peroxide.
Right.
And I go very easy with her. I just go back here and I get back. And the biggest important part is to get into the back molars. And she'll just lick. And you want to make sure you get up into the gums.
Yeah, be sure you brush along the gum line.
So right where the gums meet, and she's really, I can get her to do it. She's got nothing on it right now, so she's licking a dry brush. But you can see where she, even if I just grab and I go very easy, she's a little fighting me now, but she really gets in. I can really get in there and get her molars, and she's a good sport about it. And I just show her it too, so she knows it's nothing harmful that's going in her mouth. She knows. She's a good girl. And then if you want to get to scrape the tongue too.
So for bad breath, in humans and in dogs, it's the tongue that harbors a lot of bacteria.
Right. And I'll just scrape the tongue. There you go.
Good job.
Nice job. And you can see, you'll get a little bit of the stuff that comes off of it. But just like us and humans, if we scrape our tongue, we'll get a lot of bad breath away, right?
And that's the main source of bad breath. The other thing is, I don't know, do dogs ever get garlic in their foods or onions?
I think if they're maybe homemade, but I don't know if there's some foods on the market that might have it.
So you do not want garlic or onions because that will give humans and dogs bad breath.
Right.
All right?
And let's see, Chloe, you want to show? Show
Show
those
the
clean teeth.
Look at those teeth.
Those are some clean teeth. And that's how the dog's mouth should look. They should look nice pink, white, and no irritation
if they're brown
around the
and
gums.
bleeding, bad. Get in there and start brushing, and you may have to get them in for a cleaning with the hygienist.
Yes.
The unfortunate,
the unfortunate thing is putting the dog down.
Yeah.
And that's never good.
So if you brush your teeth, you won't have to do that hardly ever.
Correct. All right. I'm gonna let Tom finish up.
I think
we're
we
gonna
got
get
it.
down.
So any other questions or concerns, Christiana, that you can think of we need to cover? I think we've covered everything, but I just want to know that even Garfield got into this. So Garfield was being licked by the dog here. He said, you know, look there. So even Garfield, I hope he licked his perio problem before he licked me. See, so we teach our patients not to be licked by their dog because we don't want them to get reinfected. That's one of the ways you get reinfected from significant others, from pets, and also you can get disease traveling to the Caribbean. Sometimes some of the amoeba stuff are in the water.
Yeah.
So I believe that's about it.
Okay.
That's all, folks.
If you guys have any questions at all, please let us know. Dr. Tom is very willing to answer any questions that you have at all, especially if it comes to this. This has been a new area of research for both of us to kind of look at. So we're open to any questions you have at all or any concerns you might have with your doctor or the vet itself.
So the bottom line, brush your dog's teeth twice a week. Put peroxide on the brush and then finish up by putting chlorohexidine around on their teeth. If you do that, you'll save your dog's teeth and probably their life.
All right, everyone. Thank you.